Gonzalez. I work at Tecnológico de Monterrey in Mexico. And the presentation that I want to share with you is about the resolution of inflammation by metabolic changes to counteract the obesity health risk. The last one, okay. So. Okay. I don't know. Okay. Obesity is a disease that is characterized by excessive fat accumulation, in which metabolic changes might result in elevated triglycerides, visceral fat, cholesterol, glucose, high blood pressure, and HDL reduction. And all these metabolic factors are known as cardiometabolic risk factors that in conjunction can lead to diabetes, hypertension, and cardiomyopathies. Additionally, the imbalance that occurs in the adipocyte secretome include the increase of inflammatory adipokines like leptin, and also classical inflammatory cytokines such as IL-1 beta. But during the obesity, the cells are growing, and the lack of oxygen in these conditions made that cells also die by pyroptosis and necrosis. And this kind of death release autoantigens that can be recognized by immune system cells from innate that in addition activate adaptive immune cells. So this activation also produce more milieu-inflammatory cytokines that in conjunction is going to be to lead at this chronic low-grade inflammatory state that becomes systemic, and that's why this going to lead these kind of diseases like cardiomyopathy and diabetes and hypertension. So as we know, the obesity and overweight is a very growing problem that is increasing globally, but not only in adults, but there are alarming growing in children. As you can see here in these maps, the majority of the country already beyond the 20% of prevalence. So one of the biggest challenges is to recognize that obesity is not only a risk factor to develop a disease, but recognize it as a chronic progressive disease. And to do that, we have to breaking down culture roots obesity as a cosmetic issue that highlights and favors the psychological effect of body and discrimination, instead of recognize a problem that reduces the quality of life and the expectancy. So until now, unfortunately, lifestyle and interventions have not been enough to prevent the weight gain and long-term solutions. Obesity, a state of change in the metabolic changes, also promotes changes in the metabolism of other cells, such as cardiomyocytes or the immune cells, as I probably mentioned. And these changes in the metabolism of the cells supply the new demands, but also ends with inflammation and cell death of these cells. And these cell death and also an inflammation are going to enter in this cycle of the inflammation and chronicity and systemic that ends with diseases. So it has been shown, that in order to reduce this inflammatory state, we have to lose more than 10% of the weight loss, as you can see in this graphic. So is this in this context, we analyze patients that went through bariatric metabolic surgery, and in order to see if the resolution of the inflammation occurs in these patients as early as 3 and 6 months of follow-up, because we know that these patients have improvement, very important improvements in their anthropometric parameters, body composition, and biochemical parameters as early as 3 months of follow-up. So when we analyze the inflammatory cytokines in these patients, we observe that the metabolic shift precedes the resolution of the inflammation. As you can see in this graph, in this section are the metabolic parameters, and in red you are going to observe the shift between preoperative and 3 months of follow-up, and we can observe that the reduction is significant at 3 months, but not at 6 months. But sorry, at 3 months, the metabolic parameters are reduced. This reduction increase at 6 months, that is the blue bars. And when we observe the inflammatory parameters, we don't see the reduction at 3 months of these parameters until the 6 months. So when we observe the magnitude of change, we observe that all the cytokines have different magnitude of reduction at 3 months, at the very early state of resolution, but it is frankly observed at 6 months of the disease. And this is important because when we also know that patients who has already an autoimmune disease that also have an obesity, the inflammation state is very, very severe. And actually, it is being suggested that patients with obesity have an increased risk to occurring autoimmune disease, as we can see in this chart: type 1 diabetes, Hashimoto's thyroiditis, arthritis, rheumatoid arthritis, etc. So in this context, we analyze if systemic B-cell activation factors are also associated with these patients, or the resolution of the inflammation occurs. So as previously I show you, in this cohort of patients, we also observe are significantly reduced in the anthropometric and biochemical parameters. And as previously observed, at 6 months of follow-up, a reduction of C-reactive protein is observed, and IL-12 and interferon gamma are also reduced. But when we observe or analyze particularly the inflammatory factors that are associated with maturation and isotype switching and activation of B cells, we observe that they also are reduced. So these proteins are APRIL, BAFF, and CD40. These in particular are specific for B cells, and they are reduced at 6 months of being operated. And we know that interleukin 18 is a very important factor or cytokine that, in conjunction with IL-12, promotes the production of interferon gamma. And interferon gamma leads the favorites the maturation and switching of the cells in order to produce the antibodies IgG. And this class of antibodies are actually associated with auto or auto. And you can see here the patients with obesity already this class of antibodies, and they are reduced significantly at 6 months of being operated. So we know that for this B cell activation or function, T cells are also very important cells in the adaptive immune cell to develop and a full activation and recognition of the immune system. So we analyze also the activation state of T cells after 6 months, and we observe that when we are not stimulating the cells, it means we obtain blood cells from the patients previous operation and 6 months after being operated. And we observe that the cells that were from the patients, the preoperative in red, has more expression of CD69. CD69 is a surface molecule that is present in the cells that become activated. So in this section, we didn't activate the cells. So this is telling us that cells have already activated in the patient. And when we analyze the same cells after 6 months, we observe that the cells are no longer in a state of activation. And this molecular activation is positively correlated with IL-18. That is a cytokine that I previously mentioned, that it is important for B cells in innate and adaptive activation. So when we analyze specifically these cells, but we activate it in vitro, we observe that in both conditions, preoperative and postoperative conditions, they respond the same. We don't see more expression of this molecule. So this is good because this suggests that the cells are not altering their function, just simply are activated in the body. But when you stimulate in a in external condition, they have the same capacity to be activated and become activated. So this is good because the capacity of the cells remains and is not altered. And as we can see here, the resolution of the inflammation occurs very effectively. And now I like to show you how interleukin 18 is being associated with cardiac contraction impairment and patients' hospital readmission, because we have a working collaboration with the Methodist Berkeley and the Methodist Hospital, and they observed that patients with heart failure have increased levels of interleukin 18. And they also observed that patients who has more hospital readmissions events were those that has the bigger levels of this cytokine. So in this chart, we can observe that the patients, these patients, where the levels of that they have of this cytokine during the admission and during discharge remains the same, and they don't have any hospital admission. However, when the patients who had more events readmission, when they were discharged, tend to have more elevated levels of this cytokine. So we evaluate what is the effect of this cytokine in vitro in cardiac cells from rats. And we observed that the capacity for contraction of these cells was affected. Here we analyzed that in confocal microscopy, when we stimulate a cell to contract, they release calcium, and this calcium we can observe here like a very high level of fluorescence, and then this calcium is recaptured by the reticulin sarcoplasmic in the cell. So this leads to the contraction of the cells. And when we analyze these transients in different cells, that were cultured in the presence of interleukin 18, we observed that in fact the amplitude was reduced. That means that the cells release less calcium and incorporate more slowly this calcium, and this leads to the shortening of the cell. It's very reduced in comparison when they don't have any stimulation. So the capacity of the cells for contract are impaired, and also this ability to manage the calcium also give us the idea that these cells might be suffering more releasing calcium without stimulation, and that means that the cells are more prone to have arrhythmias, and also these patients must be more susceptible to sudden death. So with this, I like to conclude that inflammation is a very important factor that we have to take in consideration, and that we have to start to think in obesity as a real problem of health that we have to aware, and is a condition and is a disease and needs to be treated and prevent, because obviously I'm sharing data from metabolic surgery, but we don't think that this must be the alternative for these patients. We have to prevent the patients to get at this stage. So finally, I just want to thank all of you for listening to me and for the invitation. And I would like to acknowledge, to thank to Romeo and Ricardo Cuellar, that were the students, and one of them the surgeon for these patients, and for thank Leticia and Gerardo, that were the leading doctors that introduced me with this passion in the metabolisms, heart failure, and led me to understand these topics since the perspective of inflammation. That is my passion, and of course for the institutions Tecnológico de Monterrey y CONACYT that provide me the media and opportunity to reach my goals. Thank you very much.